But yes, please, can you hear me?
Yes, it's clear.
Okay. Can you see the slides also?
Yes, the slides are clear.
Okay, perfect. Okay. So apologies once again. My name is Rini Opariotu, as mentioned, and I'll be presenting on the need and prospects of wellness practice in Ghana. Hopefully I won't take too much of our time. I'm not sure whether I'll also be repeating some of the things that you've said, but we'll just go right ahead with it. So wellness is defined by the Global Wellness Institute as the active pursuit of activities, sorry, my sleeve, active pursuit of activities, choices, and lifestyles that lead to a state of holistic health. And sometimes we tend to confuse wellness with health and then well-being. But wellness is actually the activities that we do to help us achieve well-being. And in looking at that, it's also similar a bit to health. But with that, we are not looking at only the absence of disease because as the WHO definition of health is, it doesn't matter whether you look okay on the outside. You may not be okay mentally, even though you may look okay physically. And so wellness is the activities that we will do to help us achieve well-being. And well-being is actually a state of being in a good physical, mental, and emotional health. And it's often achieved through a balance of proactive activities. So it is dynamic. It's not you don't achieve it in a day or you don't achieve it immediately. It's progressive. So and it comes sorry, it has several aspects to it, which we call the wheel of wellness or the 8 dimensions of wellness. And I will talk about a few of them. Physical wellness. And with that, we are looking at the aspects such as regular exercise, balanced nutrition, preventive healthcare mainly. Then another example is mental or emotional wellness. Encompasses the mental health aspects. We know that wellness also covers mental health. It's not just about the physical aspect. So how are you mentally? Are you managing your stress well? Are you sleeping well? All these form parts of the mental or the emotional wellness. There are also aspects such as intellectual, spiritual wellness. And spirituality is very important in the sense that we all have a supreme being that we refer to as our God, and how you relate or how you relate your spiritual aspect of your life to your general well-being is very, very important. Sorry. And environmental wellness is also very, very important because, for example, right now we are considering what we call One Health, where we are looking at the interaction between human health, the environment, and then the animals. Because we are not living in harmony, like these three components are not living in harmony. This is what is leading to, example, the increase in zoonotic diseases like COVID-19, like the monkey pox or the mpox, etc. Because our environmental wellness is not being achieved. Occupational wellness also looks at how we balance our work and recreational activities. And then there's one very important aspect, which is the financial wellness, which I found out that some of the concepts actually excluded, but I think it's very important because relate to people socially. People tend to avoid social functions because they don't have money. They don't have money, so they can't go for outdoors, they can't go for weddings. If you're not financially stable, it can affect your mental or emotional wellness, even your physical wellness, because if you don't have money, you cannot afford healthcare. Okay. And there was a question I wanted to ask us that as we look at these 8 dimensions of wellness, let's ask ourselves, how well are you? Are you actually well? Because if you're not meeting one of these criteria, it means that you are actually not well. So that's just some food for thought. Let's think about it. If you're not meeting your financial aspect, it means you are not well. if you are not meeting your emotional aspect, it means you are not well. So I guess we all fall short one way or the other. Now, why does wellness matter? It matters because the WHO, which is like the overall, let me say, the overall health head in terms of health, actually has as one of its 17 sustainable development goals, which is the goal 3, as to ensure healthy lives and promote well-being for all and at all ages. So it doesn't matter whether you are male or female, whether you are a child, you are an elderly person. We want to ensure that you are living a healthy life and that your well-being is being promoted. Wellness also matters because in terms of work, it helps to increase our productivity and our creativity. And even on the national level, if you have a healthy population, it means that you would have a very, very productive workforce. It helps to reduce chronic diseases like diabetes, hypertension, cancers, etc. And overall, we all want to live long. I don't think there's anybody who wants to live a short life. And so wellness is very important because we all want longevity and we want to live a fulfilling life. Wellness actually also helps to lower healthcare costs because you end up spending less money taking care of people who are not well. And then it also helps to channel resources into other things, which would help increase economic output. And we know that health is wealth, and investing in the wellness of a society benefits us as individuals and the society as a whole. On your own, even if for those of us who have families, you notice that if your one member of your family is not well, it can actually put a toll on the whole family because you have to spend time in the hospital, you spend money taking care of the child and all that, and that actually puts a stress or a toll on the entire family. So wellness is actually very important. Sorry, this is a repetition of a slide. Apologies. So what is the case for wellness practice in Ghana? Globally, we know that there's an increase in non-communicable diseases. In the sub-Saharan Africa is also high, and Ghana is not left out. And WHO reports that in terms of NCDs, approximately 45% of all deaths in Ghana are linked to cardiovascular diseases, cancers, chronic respiratory diseases, diabetes, etc. And 45% means that if you take out if you look at every 10 deaths in Ghana, about half of them are attributable to these non-communicable diseases, which is actually a very, very serious state that we find ourselves in. And we know that some of the risk factors of NCDs include unhealthy diets, sedentary lifestyle, tobacco use, and harmful use or excessive use of alcohol. And these factors are actually even made worse by situations such as urbanization. Everybody is moving from the rural areas into the urban cities because that's where they feel that they will get the kind of lifestyle that they want to live. That's where the job opportunities are. So we are all moving from the rural areas into the Accras and the Kumasis and the Tamales. And with that also brings about changing lifestyles. Western diets. We are all learning how to eat the KFCs. Yeah, I said I won't mention a brand, but I have mentioned it. We are learning how to eat the junk foods and all that, which is actually not helping. The last time I was in Koforidua, I saw a KFC joint and I was surprised. Actually, somebody told me recently that some of these franchises are even opening up in places like Tamale. We have KFC joints in Tamale, we have Pinkberry, we have Chicken Man, Pizza Man. I mean, they are going into the faraway areas because they are also becoming urbanized cities. And so they are adopting these changing lifestyles as well. And another major problem we have is the limited access to healthcare services. Already, we do not have enough healthcare facilities, and access to it is also a problem because for some people, they are not able to afford regular healthcare services. So all these compound our issues for us. Now, so what's the slide on the steps report? I think I mistakenly deleted it. But recently we heard of the WHO STEPS report that was released, where the outcomes showed very, very scaring results, such as high incidence of diabetes, um, low physical activity being prevalent in especially women. There's a very high salt intake. Our cholesterol levels are very high. Um, Sedentary lifestyle generally. There's also another one that spoke about um, that I think the certain number of Ghanaians, when they looked at them, some of them have never had their blood sugar checked before, which is quite alarming. I mean, your entire life, you've never been able to check your blood sugar, and that means that you actually don't know your status, whether you are diabetic or not. A lot of people are walking around with hypertension and they are not aware. And it's actually very high. It was shown to be high in men than in women. So all these things are evidence that there is a case for wellness practice in Ghana. It's really about time. If we're looking for evidence, I don't know which other evidence again we are looking for. And the NCD report is actually to help us to take steps to address the gaps that we have seen. Okay. If all these things are showing that we actually need to take a step, then I don't know why we are sitting down waiting for as dietitians, because the evidence is really there. I think I'm missing some slides, but then we will go ahead to look at the addressing the key steps. So in addressing the key steps, it's important that we increase health education and awareness about lifestyle diseases. We we cannot leave this alone to the health promoters, those who have studied health promotion. No, it is up to all of us, all hands on deck, dietitians, doctors, provided you are giving the clients the right information. It's about time we all put our hands on deck to address the key gaps, because it is not going to go away by itself or by magic. We actually need to take these things into our own hands by educating the public. Some people are actually not aware of these things. They don't even know about these lifestyle diseases. Or they'll just tell you, oh, Matisse, or that's all I know. I don't know about symptoms. I don't know about the complications. I don't know about the effects of it and all that. And so it is a task for all of us. It's not just for a small cadre of the health population. It's actually for all of us to do. And we need to encourage regular health screenings for early detection and prevention. If we stop these diseases before they even occur, it would help save a lot of costs. And in that, the Ghana Health Service set up the wellness clinics, which is separate from the OPDs, to encourage well people who are seemingly well to walk into the hospitals to have their vitals checked. For example, your blood sugar, your blood pressure, your BMI, and then also have a chance to even have some counseling if they detect anything. So this was to encourage that we don't wait till we are sick before we go to the hospital. We should look at a preventive method instead of looking at curative. And that was the essence of the wellness clinics. Unfortunately, there isn't much information about it. A lot of people don't even know that these wellness clinics exist, first of all. And so that's also another challenge that exists. And then with regards to the prevention, NHIS has currently launched the free annual health check, which says that it's giving the opportunity to all Ghanaians 18 years and above, that once a year, that is on your birthday or on your month of birth, you would have access to a free basic checkup, which will check your BMI again, your and your blood sugar, all for free. You don't have to pay for it. If anything comes up, let's say they pick up that your blood sugar is high, you go through the normal checkup system, that is a normal healthcare system. If they find out that, let's say your blood pressure is high, you go through the normal healthcare system where you'll be referred to see a doctor, or you may be offered some counseling, or you'll be referred to see a dietitian. Okay. And all this, all you need is either to be a member of the NHI scheme, or just to have your Ghana card. And that's all. And it's actually free. So these are some of the things that are being done to help address the key gaps. And then also one thing that can be done is to develop wellness programs or workplace wellness programs to make health resources accessible. Again, I'm using the NHIS as an example because currently that's where I'm working, and this is some of the things that we are doing to help address these gaps. So the NHIS, um, the new CEO is encouraging preventive healthcare instead of curative, in the sense that if you as an insurer, you are paying for services, then you also need to keep your house in order. So now all NHIS offices are being encouraged to set up wellness clubs or wellness corners, wellness hubs, where you can do routine blood tests, blood sugar tests, your BMI, your blood pressure, and then also encourage physical activity amongst when you are tired, etc. And all you're not just looking at the main hospital. You yourself, do you own a BP monitor to check these things? These are all ways by which, as I've spoken about, moving for the NHIA, beginning 1st December, the benefits package is going to include dialysis to be free for all Ghanaians. So if you have a kidney condition that requires dialysis, now the benefits package is giving Ghanaians the opportunity. So far as you are a member on the scheme, you have the opportunity to be able to have free access to dialysis. These are some of the ways we are addressing the gap. Technology also on or a tablet in the comfort of your home. You can just look on it, request to where you can. This is actually telemedicine. You don't need to walk into a hospital. All you need is a device, like a handheld device, a phone or a tablet, and then you request to see a doctor. You put in your complaints, you speak to the doctor, whatever that you need to do, you follow through it. If you have to go to a pharmacy to get the medication, that is also available. So this is to help us achieve universal health coverage, because there were so many barriers, or there are so many barriers that prevent people from having access to healthcare. Some people have facilities that are so far away that they cannot walk there, or they don't have money or transportation, access to transportation to get there and all that. So digital access also helps us expand access to wellness resources and healthcare, especially for those in the rural areas. Now, what opportunities are ahead for us as dietitians? I think I heard RD Prince talk about a few of them, that you can partner with individuals, you can partner with people who you know are already in the wellness space. You can also partner with companies that are companies. I mean, every employee wants to improve the health of their employer. So once you're able to sell to them that, you know what, if you take care of your employees, you're going to cut down on costs, they're going to increase productivity for you. There'll be less sick days, less leave days. Today, somebody will say, today I'm not work, I can't come to work and all that. It actually increases your productivity and then your income. So if you're able to sell this to the corporate institutions, they'll buy into it. And it's actually a win-win for you as a dietitian, it's a win for the employee, it's a win for the employer as well. Okay. And then public-private partnerships. So example, just this afternoon, the reason why I'm on the road is because we actually went for a wellness launch, a wellness club launch of the NHIS in Kumasi or Ashanti region. And to be able to achieve this, they partnered with an insurance company like Vanguard. They also got sponsors from sponsorship from other companies who, who were able to help them purchase uh, to purchase weight scale and seeing the evidence, these things need to be addressed, okay? But they don't know these things. So if you're able to partner with NGOs and other companies like that, then you'll be able to actually put yourself out there to be able to provide them with the services that they need. Because we know that with regards to wellness, nutrition is very, very important. Okay, we've spoken about the workplace wellness. Also, I've mentioned the annual health check initiative by the NHIA. There are also other initiatives like the Healthy Living campaign by the Ministry of Health that is to promote regular screenings and active living. And we know that right now there's also the rise of fitness clubs. I mean, every corner you would find some fitness club there. There are lots of activities going on, even online. People are creating WhatsApp pages encourage skipping. Maybe they come up with, and then we are using technology to track it. Or we are all people come up with all sorts of things, skipping or intermittent fasting, or there are several wellness events that are going on that dietitians can actually hop on and create opportunities for themselves in the space of wellness. Okay. I think I heard Prince talking about some of these, so I will skip that. But in conclusion, I would like to say that wellness practices are not just a luxury, and I'm sure we all know that it is a necessity for addressing Ghana's health challenges, because as for the challenges, there are many. We have so many challenges in regards to disease burden and all that, which we need to address. And if we're ever looking for evidence to help us move forward, now we have the evidence. The NCD steps report is far more than enough for us to go out there and help change the lives of Ghanaians, because our disease burden is actually increasing and increasing. With commitment from individuals, organizations, policymakers, wellness can help transform our health outcomes and our productivity. So in conclusion, I'd like to say that we need to prioritize wellness for a stronger and healthier Ghana. Thank you very much. Hello, RD Prince. Please, can you hear me?
Yeah, hello. Great. Thank you very
Yes,
much,
I'm
Renee.
done. Thank you.
Yes.
Apologies for the missing slides.
Oh, that's okay. And I know you are on the road, and along the line, we're having a bit of hitches in terms of there were breaks, a few breaks, but the substance of what you discussed was clear. So please, it's time for us to have our discussion, question and answer session as well. You can raise your hand if you want to contribute. Oh, okay. I don't know, Derek. For those in rural areas, technology, internet, and smartphones will still be a problem, I believe. Thank you. So I think it's a comment well taken. All right. It seems, and we want to apologize. I think the recording was paused along the line. So a large part of what I was saying was not recorded until our attention was drawn to. So apologies. So when we send the recordings, you realize that part of what I said will not appear. Yeah, thank you. Yes, so I believe it's been a good engagement, and it's just the beginning. So we'll do more going forward. Please, any other contribution? I see Dr. Asante, I see Dr. Mwakumensa. Please, if you have any contribution to make, we'll be glad to hear from you. I've seen our immediate past Vice President, Percy Val. Percy, if you have something to say, please. Okay, Renee.
Yes, so I see a comment in there talking about rural areas not having access to internet. So, for example, the e-health platform from the Ghana Health, sorry, NHIS, it actually has the USSD form where you can just dial a code to access the platform. So you don't necessarily need internet because we considered people in the rural areas who don't have access to internet. So all these other, alternatives for it. So it's not just about people who have smartphones or have access to internet. If you don't have internet, you can still use the code to access it. Okay, thank you.
Yeah, so there's a follow-up question, I think. That I need a clarification. Renee, this one comes back to you. You spoke about the NHIS shifting towards preventive and not just curative. Would the NHIS cater for someone without any chronic condition but want to see a dietitian for a general healthy eating or consult? Asking because currently some insurance packages don't.
Yes, so currently the annual health check that is being promoted does not cover dietitian consultation. However, it is being looked into and it might or it can be added onto it in the near future. We are starting out gradually with these three interventions, first of all, and then as time goes on, we'll scale it out to include other interventions. Yes, so we can keep our fingers crossed on that.
All right. How do we sustain this campaign if people who are sick refuse to adhere to dietary recommendations and not are dealing with healthy but at-risk individuals? Thank you. Okay. So I think it's a comment. And there's a question in there. I don't know whether, Renee, you want to take a shot at it. Okay. Please, the link will be sent very soon, so please be patient with us. As I said earlier on, the moderators and all that were held up somewhere, so we are now linking up to get the attendance list so we can include it in our AHPC meeting. Okay, I can't see any hand up here. Okay, so Magdalene is asking, is requesting that we share any useful link we may have, Renee, about what you spoke about.
Sorry, the connection was breaking a bit, so I had to reposition myself.
Okay, so it says kindly share any useful links to the resources or the resources you mentioned in the presentation. Thank you.
Sure, I'll do that. I'll share it on the page.
Okay, if someone wants to register a wellness company, which body is responsible for the regulation? Okay, so Maxwell, if you are coming in as to form a wellness company, then you must have had you must have been a one professional or the other. So if you are coming to register a wellness company with nutrition wellness outlook or mental health wellness outlook. Then the professionals on the team would have to register with the various professional bodies. And if it is a clinic, let's say a nutrition clinic or wellness clinic, then you have to go to HEFRA for your space to be accredited or licensed. So we have two ways: the licensing of the premises and the licensing of the practitioners. So if you are going in as a nutrition wellness practitioner, you need to be a dietitian or nutritionist in good standing with your professional body and with your regulator. Yes. So I don't know whether Renee will add anything to it.
For that, I don't know much about the registering of a wellness company, so I can't speak about that.
All right.
Okay.
Okay.
But I see a question on, is there going to be a cap on the number of dialysis allowed in a month or period? No, there's not going to be a cap. You need to actually, there are going to be a list of facilities, credentialed facilities that, and some non-credentialed facilities, I might say, that are going to start this initiative. So I think maybe by tomorrow, the list is going to be published so that people who need to be on dialysis have that information, and then they would begin to access healthcare at those facilities. So there's not going to be any cap on it. Okay, I see another question. Are the NHI's wellness clinics available in only specific hospitals? So NHIS doesn't have wellness clinics. It's Ghana Health Service that has. And in 2020, the DG actually mandated that every health facility is supposed to have a wellness clinic. So all the government facilities have or should have wellness clinics. So if they went by that directive, I believe they all do have it. Some are not so functional because it was observed that there isn't much standardization, because some are doing, there's no standardization on the number of parameters or the things that they should look out for. So for example, some include HIV, others don't. But then the three basic checks are there: the blood sugar, the blood pressure, and then the BMI. Some do charge for the blood sugar though, but it's a very small fee. You pay something small, like 5 cedis or so for that. So NHI does not have wellness clinics, but it's Ghana Health Service that has it, and it is at all government hospitals. Yes. How do you sustain this campaign if people who are sick refuse to adhere to dietary recommendations? And now we are talking about healthy but at risk individuals. Which campaign exactly, please, if I may ask? Hello, please, can you hear me? Hello?
Yes, I can hear you.
Oh, okay. If the one who sent the question can clarify about the campaign, the specific campaign you're referring to.
The response is in the chat. The next two post. It says wellness campaign.
The wellness campaign. If people are not following, behavior change, behavior change is very difficult. Some people are naturally or just stubborn. No matter what you do, they won't change. But then you need to find adaptive ways by helping them change. Sometimes, we have different theories or different models of change. So if one is not working, you may want to try another one to see how you can get the patient to accept whatever you're giving to them. Because honestly, you can't help somebody that does not want to be helped. If the person is not ready to change, you actually can't do much about it. So it's actually I'd rather say we should try and get them to the point where they want to change. Otherwise, everything you say will just fall on deaf ears. You can't actually force the person. If they go home, whatever they do, you are not aware of it. So you may have the right intentions, but if the patient does not want to be helped, I don't think you can do much about it. You can only try and adapt different theories, but at the end of the day, it's in the hands of the client or the patient. Yes.
Yeah, I think the last hand is up. Please, you can unmute and
Yeah,
speak.
thank you for the opportunity and the wonderful presentation. How do they do and how do they do? So I just wanted you to throw some more light on certification conversation, which was part of your presentation first though. When you say certification, can you hear me?
Yes, I can.
So when you say certification, I mean, what is your prescription of how we can ensure professional certification in the wellness and other related fields, especially when there's no standardization across government health agencies. Ghana Health Service has their own wellness definition and how they're implementing it. CHAG and all the other Ministry of Health, they all have their own wellness concept. How do we ensure certification in this environment?
Yeah, so as it is, as I intimated, thank you for the question, Percy. And also please, before I continue, the link has been posted on in the chat box, so kindly fill the attendance link, please. Thank you. Yeah, so like, as the mode of operation has always been, we'll have a team of experts to sit and review our environment, the world mode of operation or the trends across the world, and the current wellness outlook in Ghana. Then we'll come up with the real point of interest, where which will be the basis of assessment and certification. So we intend to do a real work within the country, in-country outlook and the world or international trend. Then together we can come up with. Fortunately, some of us have been involved with the implementation of the wellness in the Ghana Health Service and other places. It's not really too different in terms of what they seek to do. They're only implementing small aspect of wellness. So I don't see it becoming an issue, only that ours, or what GAND will seek to do, will be very expansive. So we'll be able to meet both the local outlook and international trend as well. Over. I hope that helps, Percy.
Yes, sir. Thank you very much. I'm grateful.
Welcome. Once again, please, we have posted the attendance link. Kindly fill it and show, especially your HPC number. Please fill it well. Okay. So since there are no more questions, we want to give these few announcements. We want to, first of all, apologize for the slightly late start of the program, and also that we didn't give you the joy of having moderators, because our moderators found themselves in a place that they couldn't help. But I believe we've had an engaging session, and that we've provided things to think about and things to stimulate our minds, so we can really meet the needs of our people, prevent the diseases that there are. God willing, January, we will publish the members, registered dietitians in good standing, registered nutritionists in good standing in the daily graphic and on our website and all our social media handles. So please, we have published the names of those who are in good standing now on our various pages. Kindly take some time, go through. If your name is not there, then probably you have not paid your dues. And kindly do so, pay your dues, so we can have the small amount of money we require to run the organization and also bring it to the place we all want it to be. So please, I see only a little under 300 who are in good standing now. Kindly check on the nutrition page, the dietetics page, and the Telegram page as well. And if your name is not there, please go to the website, update your membership or renew your membership, and everything will be fine. Thank you very much. Renee, please, do you have any last words?
Hello. Yeah, I just want to thank you for the opportunity, and once again apologize for the hitches because I was on the road. But then I would share the full presentation on the page so that anybody who wants to have access to it can. So thank you all once again.
Welcome, welcome. Thank you also for taking your time off to prepare to be of help, a good resource to us as GAND. All right. At this stage, someone is asking links and information on wellness-related courses, both online and offline, can be shared on the pages members to have access to them. Great recommendation. We'll do that. Then, how can dietitians take advantage of the wellness and mental health opportunities? Should dietitians develop a mental health specialization? Food for thought. But you see, we have there's only we can only go so far in terms of how we can crisscross into other specialties or other domains. So that we have what we call the working knowledge of nutrition. You know, so you see other people, they study nutrition to an extent, but we can think about it as of whether we can have a specialty in mental health, or as of whether mental health council can have a specialty in nutrition. I don't know. It's a gray area. It's a place to think about, and we can think through and see what we can do. All right. So please, I believe all of you are filling the forms so that you can be accredited. Your category B2 points can be allocated appropriately. I can see Dr. Steiner-Asiedu. Dr. Steiner-Asiedu, please, can you give us a closing prayer?
Hello, Dr. Prince Baby. Please, can you all hear me?
Yes, please.
Please,
yes.
can you hear me?
Yes.
Okay.
Clearly.
Shall we please pray?
Mm.
Our Heavenly Father, we thank you so much that you have given us this day and this opportunity to gather to study. We thank you for all the knowledge we have acquired in this webinar. We thank you for our presenters and all the organizers. We pray that you help us, that you apply all that we have learned and become better at every institution where we are working and be good ambassadors even of the profession that we are in. We ask for your goodness and for your mercy to continue to be with us. In Jesus' mighty name have we prayed with thanksgiving for answered prayer. Amen.
Amen. Thank you so much. Thank you so much. I will give a few minutes for those who haven't filled the form, to please fill the form. Then we'll wrap up. Whilst we do that, I'll pause the recording.